Good evening and welcome to Montgomery Heart Wellness YouTube channel. It's Dr. Montgomery's Clinical Pearls. And what I'm going to do today is share some information I received on my news feed. As I shared with you the other day, this news show of ours is one where I'll come on and give you clinical pearls and insight into different medical issues, however they come up. Most of the time, I'll deal with issues that I'm faced with in the clinic. We have patients that come in all the time with different medical complaints, problems, or unique problems we have to solve. We work through those problems, and I think it'd be a good idea, at least, as I came up with the concept here, I thought it'd be a good idea to share these thoughts and this thought process with you online. And so I decided to come on and share this piece of information. Now, many of you recall back, so January 2nd, Monday night football game, Damar Hamlin suffered a cardiac arrest. There was a large audience at that time. And, of course, our prayers and thoughts were with him, and our prayers and thoughts are still with him as he makes a full recovery. In fact, my understanding is that he has made a full recovery. However, I saw in my news feed that he has come forward and shared information about what his doctor shared with him about the cause of his cardiac arrest. So lots of people were speculating in terms of what the cause was, and there are a lot of people coming out saying a lot of different things. I heard about the event that night. I wasn't watching the game, but I recall I was at my desk doing some work, and was called by a friend of mine who was watching the game and said, "Hey, this player had a cardiac arrest shortly after being hit in the chest." And the first thought that came to my mind was a condition known as commotio cordis, blunt trauma to the chest. If it's done at exactly the right time, or perhaps the wrong time, depending on how you look at it, can change the electrical signal of the heart. And so that was my initial diagnosis. In fact, I went on and talked about commotio cordis. Now, what I want to do right now is share updated information. So Damar Hamlin has come out and shared some information about what the cause was. And I'm going to share this with you first. We're going to come back, analyze it, and I'm going to give you some of my inner thoughts in terms of what might have been the cause, what things we should consider, and so on and so forth. So why don't we start off here? I'm going to share this little video clip, and hopefully you'll be able to hear this. It's going through my speakers. Here we go.
Few months, I've been on a journey, and I've seen, some of the top professionals across the country, and their answers to me were pretty much all the same. They were the same, and this event was life-changing, but it's not the end of my story. So I'm here to announce that I plan on making a comeback to the NFL. So the diagnosis of pretty much what happened to me was basically commotio cordis. It's a direct blow at a specific point in your heartbeat that causes cardiac arrest. And 5 to 7 seconds later, you fall out. And that's pretty much what everyone's seen January 2nd of this year. Commotio cordis is the leading cause of death in youth athletes across all sports. So that's something that I personally will be taking a step in to make a change. And also, with that being said, all the awareness around CPR and the access to AEDs have been lowering that number as well. My heart is still in it. My heart is still in the game. I love the game. It's something I want to prove to myself, not nobody else. It's just, I just want to show people that fear is a choice, that, you can keep going in something without having the answers and without knowing what's at the end of the tunnel. Or, you might feel anxious You might feel any type of way, but you just keep putting that right foot in front of the left one and you keep going. I want to stand for that.
Okay, so there you have it. He's coming back. I suspect he's received clearance from his doctors, his cardiologist, that he can go back and compete. That's all great news. Apparently, whatever contributed to his sudden cardiac arrest was reversible. Now, this whole condition of commotio cordis, I'm going to share a link with you. And if you go to our channel, and by the way, please hit the thumbs up if you're watching this, and if you like what you hear and like what the information you're getting. And this also helps get this message out to more people in the algorithm. The other thing is that I want you to share this if you haven't, and subscribe if you hadn't had a chance to subscribe to the channel. You'll get notifications of the topics. I'll be giving more information, health information, and updates over time. I'm going to put in a link here, the previous link when I went on, this was January 2nd, I went on and talked about commotio cordis and talked about it in detail. And that information, I think you should have. You should look at, because it goes and talks about this diagnosis. What I'm going to do now is give you like a brief summary or overview of what commotio cordis is, and essentially give you some kind of understanding of what he's talking about. So let me share my screen here, and this diagram is a diagram of a baseball, and this is the sternum of someone's chest, and right behind there's the heart, and then it shows you some other images here, and I'll explain that in a minute. In summary, commotio cordis is a situation when you have blunt trauma to the chest, as I said before, and it hits your heart, or your chest, I should say, at the right time, or perhaps wrong time, how you want to look at it, where it can cause an electrical change through a mechanical force. So a mechanical force hits the sternum, that mechanical force gets transferred to the heart, and then the mechanical force and changes, the stretch and relaxation changes in the heart muscle and cytoskeleton can be disruptive to the electrical circuitry that goes on in the heart. So if that occurs at a certain time during the electrical cycle, it can then cause a total disruption and put you in what's called ventricular fibrillation arrest. So here the diagram shows an impact of a certain velocity, tend to estimate about 40 miles per hour. That's based on some animal studies. That could vary, in human studies, etc. Direct contact with the chest, sort of like maybe to the left of the sternum. And it happens at a time of the electrical signal, say right about here. Now, I spent many years working as an electrophysiologist, and part of our job was to evaluate the electrical circuitry of individuals' hearts. The electrophysiologists, we were the electricians. And so I spent a lot of time, I put thousands of patients into cardiac arrest. We used to do it with electric catheters. We would also place a stimulation right here. You have this QRS, this little spike here is electrical circuitry that goes to the upper chamber. This big spike, when the electrical circuitry goes to the lower chamber. And this hump here, we call it repolarization. That's when the electrical signal, the electrical construct of the heart is changing back to its baseline, so it can get ready for another electrical circuitry to come down. This is a vulnerable time where if you get a special type of electrical signal here, you can throw the heart into electrical disarray. And so this can happen with an electrical signal, like with a pacing wire, or we used to be able to shock the heart right at this time. And if you put enough of an electrical signal right here, it then throws the heart into electrical disarray. And notice how these humps here are in jagged disarray. So this is called ventricular fibrillation, or VFib. So the ventricle goes from beating in a symmetrical, controlled manner to then fibrillating. And when it fibrillates, it doesn't circulate the blood. Normally, when it doesn't do that, the blood pressure goes to zero and you collapse. And if it stays fibrillating, the blood circulation stays to zero essentially because it's fibrillating, it's not contracting. If you don't do anything to shock it out, you have to shock. It's also like slapping somebody or rebooting your computer when it's got a lot of static noise. So you got to shock it back to where it's beating sequentially now. And so that's where they have the defibrillators, get the paddles, you charge them, boom, you shock it back. So you can shock it into VFib, and you can shock it back out of VFib, but you don't need to have an electrical shock to put it in VFib. You just need to have something that causes enough of an electrical signaling at this point to where you can change the whole circuitry. So commotio cordis is a clinical syndrome where with blunt force to the chest, you can have mechanical transformation from the chest wall through into the heart muscle, and that mechanical force can change the architecture of the cardiac muscle and cytoskeleton to where it disrupts the electrical signal. And so you see here cell membrane stretch, and electrical circuitry goes through these cells. And if this happens at the right time, ion channels are changed, etc. So you have an electrical change. A mechanical force goes in, creates an electrical change or change in electrical signaling, and it puts the heart into cardiac arrest. So that's commotio cordis. You go into ventricular fibrillation. If somebody's alert, you see that happens, you shock them out. And by the way, for those of you looking, if you are at, your son's Little League baseball game, or, your kids have, you have your kids in karate, these things happen in these events. I don't think the data is that it's the most common cause. I think hypertrophic cardiomyopathy, at least classically, used to be the most common cause, and still maybe. I'll have to check the statistics, but it is, something that is seen. Do know that if you see a kid collapse after getting blunt trauma to the chest, immediately start doing CPR and immediately call 911, get the ambulance on the way, and have someone search for an AED nearby. Do CPR nonstop until someone comes with a defibrillator or an AED to shock that young athlete out of that arrhythmia. Because, blunt force to the chest, sudden collapse, you want to think commotio cordis, and you want to address that. So, Damar Hamlin mentioned the need for having more widespread AEDs available and the like. And I think all of that is appropriate because commotio cordis is a real entity, and it's a problem that we must be aware of and be ready to deal with. Now, what do I think? Well, I'm glad you asked because my initial thought, as I said, that when I heard about this, and my friend was talking to me on the phone, I hadn't seen anything. I was not watching the game. He just said, look, a player was in cardiac arrest after he got hit in the chest. First thought came in my mind, I even said it to him on the phone, commotio cordis, blah, blah, blah. And so I looked at some videos. I saw some video shots of him getting hit in the chest, and I went and did a show on commotio cordis. Look on my YouTube channel on the Damar Hamlin collapses. And I think I'll go through a detailed explanation of that, showing the video. What are my thoughts now? My thoughts now, again, I don't know what happens. I wasn't any of his treating physicians. I don't have the data. This isn't medical advice, or I'm not providing a second opinion. However, what I will say is the following. A condition like commotio cordis, once you've shocked that person out of ventricular fibrillation, typically it's over. It's over, meaning that they're back into normal rhythm. The heart's back into rhythm. It should not go back into ventricular fibrillation unless you get another blunt trauma chest, blunt hit to the chest at the right time, et cetera, which is, 1 in a million. But shocking someone out of VFib arrest after you induce VFib by commotio cordis or any other similar mechanism. Remember, I've put thousands of patients in VFib arrest, and we shock them out. And these are patients with individuals with sick hearts, so they have ischemia and other things. And once you shock them out, they stay out. Now, what causes someone to go back into ventricular fibrillation would be an underlying driving mechanism. Now, why do I mention that? I mention that because during the aftermath of Damar Hamlin's cardiac arrest, they were getting updates. Family members were providing updates. There's a particular family member, this was within a couple of days, who was giving an update, and they shared with the audience, the general public, what happened. And what they shared with them was, and this was someone who was, communicating with the doctors directly and was uh, um, a person who was an accepted spokesperson for the family. I don't remember his relation to Damar Hamlin, but anyway, what he said on one occasion, I remember it clearly, was that he went to cardiac arrest. They resuscitated him. When they got to the emergency room, he went into cardiac arrest again, and they had to shock him back again. So his heart stopped again. It's shock him back again. A light bulb, when I heard that, a light bulb went out. The reason is, and why I kind of explain that, I want you to again hit the thumbs up button, give us a love. Please subscribe, share along the way. But the reason the light bulb went out is because of this. As I said before, when you are induced ventricular fibrillation through a sudden shock, commotio cordis, or electrical shock, etc. Once you've terminated ventricular fibrillation, you should not go back in. What causes you to go back into ventricular fibrillation is an underlying driving mechanism. What is that? What I mean by that? If someone has coronary disease and one of the arteries of the heart is closing off or trying to close off, it's sort of shutting off oxygen and blood flow to tissue. It can irritate it. It can cause it to go into ventricular fibrillation, get shocked out. But if the ischemic trigger is still ongoing, then it can probably go back in again, VT or VF, and it may need to be shocked again. An electrolyte abnormality, the electrical circuitry gets thrown off because your potassium is very low or magnesium extremely low, and you could be going in and out of this cardiac arrhythmia. So that's an ongoing driving condition. A body that's acidotic, persistent inflammation, okay, could contribute to this ongoing driving force. So based on that piece of information, it seems to me that there was some underlying process that was going on inside Damar Hamlin's body that was causing him, or at least caused him, to go back into cardiac arrest. When he got to the emergency room, they had to shock him back out. Apparently, when he got into the ICU, they did things to stabilize his condition to prevent further episodes. This, in my opinion, makes the diagnosis of commotio mortis much less likely. Okay, it makes it much less likely because commotio mortis, once shocked out, you should stay out. If there's an underlying driving mechanism, now granted, you could have had commotio mortis as an initiating factor, but there must have been some underlying process that caused them to go back into this ventricular fibrillation, thus requiring another cardioversion or shock. So I think there's more to the story that's been released here. You may remember the interview that Damar Hamlin did with Michael Strahan, and he was asked point blank, what did the doctors share with you? What did they say was the cause of your cardiac arrest? And he paused and he says, I don't want to discuss that right now. I don't want to share that. So I thought that was quite peculiar because there was quite a bit of time after things had settled down. And he clearly had time to talk to his doctors to get information as to what the cause was. I mean, everyone up front was saying commotio cordis was the likely cause based on the initial information that we had. Myself and many other experts were speculating as commotio cordis being the cause. Now, a lot of people are saying a lot of other things, but based on the initial information we had, commotio cordis was a reasonable condition and different. It didn't mean nothing else could have caused it. Other things still could have been the cause. Could have had a heart attack, I don't think it was lightning strike. Nobody saw lightning. So maybe a lightning strike was not a likelihood because nobody saw it. But, commotio cordis was high on the differential. Other things were things to be considered. But when you go have another cardiac arrest and it has to be shocked out again, then we have to move the other possibilities higher on the list. Those other possibilities could be ischemia. It could be electrolyte abnormalities. It could be inflammation such as myocarditis. It could be, uh, a primary electrical disorder, long QT syndrome. Sometimes you can go into these electrical circuits, dehydration and setting a long QT syndrome. You can have recurrent, arrhythmias, Brugada syndrome, these things. But these things would have been diagnosed. If you had a hypertrophic cardiomyopathy, sometimes they can have recurrent VFib, due to an underlying cardiac abnormality. But these things are diagnoses that, hypertrophic cardiomyopathy or long QT syndrome or, these types of things would have led to them saying, well, you need a defibrillator. He had some condition that apparently was reversible to the point that one, he didn't need a defibrillator. So one, he likely doesn't have a weak heart. It's not like he's an athlete and all, but it's like he doesn't have a weak heart. Could it have been an electrolyte abnormality? That's certainly a possibility. That could be corrected, and that's something that would be taken care of. If that was the case, I suspect he would probably say, "Hey, my potassium is very low," unless there's some unusual reason. So the concern could be that did he have inflammation of the heart, or was this myocarditis? And was this myocarditis? What caused the myocarditis? A lot of speculation as to what could have caused its myocarditis. I'm not going to speculate on that. I don't know if he had myocarditis or not. What I'm here to say is that based on the information that was released around the time, one has to give other potential causes a higher likelihood, given the fact that it was reported that he had another cardiac arrest upon arrival to the emergency room, where he had to be shocked out again. Commotio cordis would not cause it, so I don't jump to that diagnosis right away. You have to have some kind of an underlying driving mechanism to cause it to go back into cardiac arrest, at least by and large. So, that's my take on it. Again, please, if you have any questions, ask it in the chat. I'll have my team to be working on the chat and following the questions in the chat, and we'll try to address as many questions as we can. But again, these are my thoughts. Please like and share and subscribe and hit the notification button if you want to hear more of our insight. But that's my take on it. And if I learn more about this, I'll come and share more insights. Until then, you take care.